Hi, let's talk about the laryngeal muscles. In this video, we'll talk about the intrinsic laryngeal muscles. We'll talk about how they'll affect either the positions of the vocal ligaments or vocal pitch. Before we get to intrinsic laryngeal muscles, we should talk a little bit about how sound is formed and other types of muscles that can affect sound as well. So, sound is the result of air moving out of the vocal tract and being affected by the structures which comprise the vocal tract. So everything from the larynx, the pharynx, the nasal and oral cavities, the contents of those cavities, such as the tongue, the areas surrounding the nasal cavities, such as the paranasal sinuses, and so on and so forth. So there's a lot that the body does to affect sound. Now, muscularly, there are two sets of muscles, as described, that can affect sound. There are extrinsic laryngeal muscles and intrinsic laryngeal muscles. Extrinsic laryngeal muscles are going to pull on the larynx, but generally have an attachment site that is outside of the larynx, whereas intrinsic laryngeal muscles have their attachment sites within the larynx exclusively. So when we talk about extrinsic laryngeal muscles, we can talk about things like the suprahyoid muscles, that are going to pull on the hyoid, and by doing so, because the hyoid is attached to the thyroid cartilage via the thyrohyoid membrane, it also pulls on the larynx as well. So these suprahyoid muscles are able to affect sound by elevating the hyoid, which elevates the larynx. When you elevate the larynx, you're actually shortening the laryngopharynx because the laryngopharynx is posterior to the larynx. So if I were to draw this box as the larynx, the laryngopharynx would sit posterior to that. And when you elevate the larynx, you're also pulling the laryngopharynx superiorly, thereby shortening it. Whenever you're shortening a tube, that's going to raise the frequency of the sound in that tube, and that also elevates pitch. By contrast, infrahyoid muscles, or those strap muscles, are going to lower the larynx. When they lower the larynx, and they usually do so by depressing the hyoid bone, although there are several infrahyoid muscles that can elevate the larynx by pulling the thyroid cartilage superiorly, but as a whole, infrahyoid muscles, by depressing the hyoid bone, they lengthen the laryngopharynx, because by depressing the hyoid bone, that puts a little less tension on the larynx, and it allows it to drop a little, and by dropping that a little, it overall increases the length of the laryngopharynx, which thereby lowers the sound frequency within that, or lowers pitch. The other group of muscles, and these are going to be the focus of our discussion today, are the intrinsic laryngeal muscles. So again, intrinsic laryngeal muscles have both attachment sites within the larynx, or the laryngoskeleton. And these muscles are able to affect sound in two major ways. They do so by affecting the shape of the rhemoglottitis, so by either abducting or adducting, so moving the vocal folds away from each other, or adducting toward each other. Or they can affect tension on those vocal folds. And we can see how that's done, and we can also see how sometimes tension can be a function of whether those folds are either abducted or adducted, as we'll see. So before starting off, I kind of want to show you all these intrinsic laryngeal muscles from a superior view and give you just a 10,000-foot overview of what they're doing, because I think that this is helpful before we get into the weeds of where they are and what they do. But so these are all superior views, and here is the thyroid cartilage. Again, here's the cricoid cartilage. Here are the arytenoid cartilages. And then here are the vocal ligaments, which are spanning the distance between the thyroid cartilage and the vocal processes of the arytenoid cartilages. We can also see the muscular processes of the arytenoid cartilages as well. So the first muscles that I'd like to discuss with you now are the ricothyroid muscles. We'll find that a lot of these muscles are exquisitely well named. So there are two sets of muscles that are shown here. There are thyroarytenoids, and then there are cricothyroids. The cricothyroids are the muscles that are running between the cricoid and thyroid cartilages. So when the cricothyroid muscles contract, they work upon the cricothyroid joint. Recall, that joint is between the inferior horns of the thyroid cartilage and the cricoid cartilage. And what happens is the thyroid cartilage tips anteriorly and inferiorly. When that tips anteriorly and inferiorly, these vocal ligaments get stretched out. By stretching out the vocal ligaments, that increases their longitudinal tension, and that elevates pitch. The next muscles do nearly precisely the opposite of that, and these are the thyroarytenoid muscles. The thyroarytenoid muscles run between the thyroid cartilage and the arytenoid cartilage. See, I told you that these were exquisitely well named. And what they do when they contract is they draw the arytenoid cartilages forward. When they draw the arytenoid cartilages forward, this decreases their longitudinal tension and decreases pitch as well. In this process of drawing the arytenoids forward, they also slightly adduct the folds as well. So they can narrow the rima glottis. They don't completely close it, but they narrow it off. Now, one thing to know about this muscle is that there are specialized fibers of the thyroarytenoid muscle that insert directly on the vocal ligament. So they're not necessarily all running between the cartilages. Some of them are actually attaching to the vocal ligament. These are sometimes referred to as their own muscle. Sometimes we call them the vocalis part. Some folks call them the vocalis muscles. And when these muscles are activated, they increase the lateral tension on the vocal ligament. And by increasing the lateral tension, that changes the timbre, so the tonal quality of the sound as the vocal ligaments vibrate. And also by increasing that tension, they can finely elevate pitch. The next set of muscles are the posterior cricoarytenoid muscles. These posterior cricoarytenoid muscles, again, everything is in the name. They are posterior of this group because there's also a lateral group, and they attach the cricoid cartilage to the arytenoid cartilage. And what they do when they contract is they're going to outwardly pivot the vocal process of the arytenoid cartilage. And when they outwardly pivot that vocal process of the arytenoid cartilage, the vocal folds abduct. and thus we maximally open the rima glottis. By doing this, we're also increasing the longitudinal tension ever so slightly, so this can elevate pitch slightly. These are important muscles because they are the only muscles within the larynx that can increase the patency of the airway. The other set of cricoarytenoid muscles are the lateral cricoarytenoid muscles, and these, as you may guess, laterally attach the cricoid cartilage to the muscular process of the arytenoid cartilage. And when these contract, they inwardly pivot the vocal process and thus adduct the vocal folds. So these muscles can very nearly close the entirety of the rima glottis. So these are going to be important muscles for the Valsalva maneuver, so that straining of force against the vocal folds. And then finally, we have the arytenoid muscles. The arytenoid muscles, as their name may suggest, connect the arytenoid cartilages to one another. And there are two sets of arytenoid muscles, and they're named based on how their fibers run. There's a set where their fibers run transversely, called the transverse arytenoid muscle. And then there are a set which run obliquely, crisscross, which are called the oblique arytenoid muscles. Working together as a pair, they glide the arytenoid cartilages together, so they adduct them, and by doing so, they also adduct the vocal folds. So let's look at each of these muscles individually and in greater detail. And let's start with the posterior cricoarytenoid muscles because, well, for one thing, they're very prominent when you're looking at the posterior aspect of the larynx. For another thing, they're oh so darned important because they're helping to maintain a patent airway. So before we really begin, let's think about what we're seeing here. So there's our cricoid cartilage, like so. Our arytenoid cartilages are going to be sitting atop the cricoid cartilage, like so. And out laterally here is going to be that muscular process of the arytenoid cartilage. So the posterior cricoarytenoid muscle runs from that muscular process back to the posterior aspect of the cricoid. So very well named. Very, very well named muscle. When that muscle contracts, it outwardly pivots, and we are able to abduct the vocal fold and open the rima glottis. This is an extremely important set of muscles for ventilation. By doing so, this also moves the vocal ligament slightly posteriorly, so we're increasing vocal tension. So this is one of the muscles which increase pitch, not dramatically, but ever so slightly. And this set of muscles, like every set of intrinsic laryngeal muscles except for ricothyroid muscle, are innervated by the recurrent laryngeal nerves. Now let's take a look at the transverse and oblique arytenoid muscles, or just the arytenoid muscles. So again, there's cricoid cartilage. The arytenoid cartilages would be there and there, and spanning the distance between them here, we can see here are the transverse portions of this muscle. So the transverse arytenoid muscles are going to be very good at gliding the arytenoid cartilages together, so they're adducting those cartilages. We also have these oblique arytenoid muscles. And the oblique arytenoid muscles are also going to adduct the arytenoid cartilages together so as to close the rima glottis. Closing the rima glottis is an important thing for phonation because in order to vibrate those vocal folds, we need to put them in the way of expelled air. So adducted folds are folds that are active in phonation. There's also an additional part of the oblique arytenoid muscle, which is going to be important here. And I'll circle it there. This is known as the airy epiglottic part of the oblique arytenoid muscle. That airy epiglottic part gets its name because it's connecting the arytenoid cartilage with the epiglottic cartilage. Now, the two of these muscles actually help to form a partial sphincter around the laryngeal inlet. So they can help decrease the size of the laryngeal inlet to produce a more powerful or a greater velocity of air as it exits from the larynx. The arytenoid muscles, like nearly all of the other intrinsic laryngeal muscles, are innervated by the recurrent laryngeal nerves. All right, now the other cricoarytenoid muscle, the lateral cricoarytenoid muscle. So the lateral cricoarytenoid muscle runs from the lateral aspect of the cricoid cartilage to the muscular process of the arytenoid cartilage. And when active, it pivots the vocal process inwards so as to adduct the vocal folds. So this helps for phonation as well as helping with the Valsalva maneuver. In this particular image, what's happened, you can't see it anteriorly, but this is this is the thyroid lamina that it's been cut along the midline, and we have reflected it outwards. By reflecting it outwards, we can see this lateral cricoarytenoid muscle there. So here is the muscular process deep to this point of the arytenoid cartilage, and we can see here is that posterior cricoarytenoid muscle. And we can see that it's meeting that lateral cricoarytenoid muscle at the muscular process. So the posterior and the lateral cricoarytenoid muscles are in a contest to see which direction that muscular process can be pulled. The posterior for ventilation, the lateral for phonation. And the lateral is innervated by the recurrent laryngeal nerves. Finally now, we have, we have the thyroarytenoid muscles. The thyroarytenoid muscles are really interesting muscles because they're connecting the thyroid cartilage with the arytenoid cartilages. And when they contract, they glide the arytenoid cartilages anteriorly, and by doing so, they decrease the tension and lower the pitch on the vocal ligaments. But there are specialized fibers here. There are a couple of specialized fibers of the thyroarytenoids. These are attaching directly on the vocal ligaments, and as they pull on the vocal ligaments, that can do one of two things. It can increase lateral tension, and that increase of lateral tension, if we were to look at a cross-section of a vocal ligament, let's say that it just kind of looked like this, it could pull on that like so as to flatten that vocal ligament out, so as to change the timbre or the tonal quality of sound as it vibrates that vocal ligament. Because we're also adding tension, that can finally increase pitch as well. There's also another part to the thyroarytenoid muscle, sometimes called its own separate muscle, but this runs between the thyroid here and the epiglottic. So these fibers come up laterally like so, and we can see some of them through here. These are the thyroepiglottic part of the thyroarytenoid muscle, and these would actually work in concert with the aryepiglottic parts of the oblique arytenoid muscles to help shape the laryngeal inlet. But in this case, the thyroepiglottic part actually helps to pull the quadrangular membrane and mucosa away to help dilate the inlet, whereas the aryepiglottic part of the oblique arytenoid is more of a sphincter of that outlet. So they're working in concert with one another, but they're doing the opposite things. The thyroarytenoid muscles and all of their parts are innervated by the recurrent laryngeal nerves. Now, that finally leads us to the cricothyroid muscle. So we've seen the cricothyroid muscle here running between the cricoid cartilage and the thyroid cartilage. We've also seen the cricothyroid muscle here, and there are a couple of large-scale parts to that. And these are going to affect motion at this synovial joint, the cricothyroid joint. So when they activate, they pull the thyroid cartilage forward and downward. So they're going to tip it antero-inferiorly. When they tip the thyroid cartilage antero-inferiorly, that lengthens these vocal ligaments and increases the tension on them, thus increasing pitch. These are special muscles in terms of innervation because they are innervated by the external branch of the recurrent laryngeal muscle. And owing to this large distance, they can really increase pitch. The other thing that I should probably just draw your attention to while we're here, make it worth the trip, with respect to a cricothyrotomy, that median cricothyroid ligament is located medial to the two sets of cricothyroid muscles. So that would be in this space here, and that would be the area that is incised for a cricothyrotomy. Which leads us to our assessment question for the video, and that is, a person wanting to powerfully elevate the pitch of their voice must use which nerves to do so? Let's see, external branches of the superior laryngeal nerves. Well, in terms of the intrinsic laryngeal muscles, they would innervate cricothyroid muscles, and those are very powerful elevators of pitch. Internal branches of superior laryngeal nerves, these are afferent and secretomotor to the mucosa superior to the vocal fold, so I would say that's out. Recurrent laryngeal nerves, nearly all other intrinsic laryngeal muscles, but none of them are very powerful elevators of pitch. Many of them are just minor elevators of pitch, so for now I think that the external branches of superior laryngeal nerves are winning. And then finally, vagus nerves. Well, aren't all of these branches of vagus nerves? To be quite honest with you, I find vagus to be too general an answer for this. So when addressing multiple choice questions like this, you should always go with the answer which is the most specific while not being technically incorrect. And therefore, the correct answer would be A. Thank you very much for your time.